And joining us now is President Trump's former Homeland Security and Counterterrorism advisor and ABC News contributor Tom Bossert. Thanks for your time, Tom. You've, of course, criticized the president and administration in the past for downplaying the virus. Just today, we saw his chief of staff, Mark Meadows, without a mask as he was briefing reporters. And we learned that there will still be no mask mandate at the White House, a White House memo saying that it's a personal choice. Do you think that the president and First Lady testing positive will be any sort of wake-up call to change how the administration deals with COVID?
Yeah, I hope so. There's really no debating it anymore. It looks like the numbers, unfortunately, are starting to show both increases in the age demographic of high school and college kids and the older generations around those schools. And so that's bad news. It indicates that we might see an increase in the new death case tolls or the new death rates, all through November. And that's really a bad sign. It shows a lot of sickness in 25 to 30 states. And it shows a lot of people getting sick right now in Washington, D.C., so it means there's more virus in the city and in places where we might have large gatherings, and that's where these super spreader concerns take hold. So hopefully all the young staff in and around Washington, D.C. and around the president and campaigns understand how serious this is. And if we can't keep the disease away from the president of the United States, we're really not going to have an easy time keeping the disease from any other elderly person in this country. There's a myth that sounds like really, really attractive that, well, all we have to do is keep it away from people that are in certain age demographics. And that's just really tragic evidence that that's not possible. And listen, it's not a time to criticize the president at all. It's really a time for well wishes. I will say one thing about the last speaker in that conversation. The one contrary point to the rule of everyone saying good things and wishing well to the president seems to be the Chinese state media today. They took an opportunity to start taking pot shots at the president, mocking him for his treatment of this. And it's really troubling for how they're viewing this opportunity.
And you worked, of course, with the president. If you were still in the White House, how would you advise his teams dealing with the unfolding medical situation and transparency? I mean, would you say, in your estimation, that it's better to widely share information or, for national security implications, not reveal too much?
Well, there's some things that have to be kept close hold with respect to the president's condition and his health. His health condition, he's a human being, and his health condition is private as a general matter, but there are larger conditions. Listen, in addition to being the Homeland Security advisor, I had another really unique role, one I was instrumental in creating after 9/11 for people that were then my bosses, and that is the National Continuity Coordinator. It was my responsibility to coordinate the continuity not only of the federal government, but to interact with the other branches of government to make sure that we had an enduring constitutional government. All three branches surviving and having their operations continue, or at least their mission essential functions continue through any circumstance, was our objective. So right now I'd be telling Vice President Pence, despite his instinct to get out and get on the campaign trail, that he's got a larger obligation to the Constitution and the country. He needs to sit himself down, get somewhere where he's not exposed, not take any risk. And, although the president's condition from public reporting seems to be fair, he seems to only have minor symptoms, the vice president can't take that chance. He's in the line of succession, and he's going to go have to park himself somewhere. And then secondly, I'd be communicating with the others in line of succession, but more to the point of keeping the Congress and the Supreme Court in similar good health so that all three branches can continue to operate at the same time.
Just curious, I know that that's your advice, that the vice president should park himself somewhere. Do you think that that will happen?
Well, right now there's still some indication that he intends to go out and continue some of his planned campaigning. I don't know what the inside conversations are right now, but if he's interested in my 2 cents, I'd be giving him a really strong caution not to do that. I suspect that the chief of staff on his team and the president's chief of staff are probably hearing that kind of advice right now. The White House Military Office seems to be taking continuity precautions for the continuity of the presidency, and I suspect that they're giving him all sorts of alternatives and opportunities to take this advice. So I wouldn't be surprised if they're not saying it today, that they choose to take this advice by tomorrow.
And really staying on those same lines, what do you think that the Trump administration needs to be doing right now to control the spread of the virus within its own ranks, and also what needs to be done to keep the wheels of the government working?
Well, if that advice that you read earlier is accurate, that they're saying that it's still a personal choice on masks, it's just a fundamental misunderstanding of the mask advice. It's just one of many, really prophylactics. It's not a cure, of course. But the idea of a mask isn't just simply a personal choice. It's a matter of collective responsibility. So the messaging on this has to be clearer. There's been so much confusion. It's almost difficult to continue to repeat myself, not to you, but to a lot of the people that spread misinformation about this virus. We know how it spreads. We've known how it spreads and the rate at which it spreads since the Diamond Princess cruise ship. There's been no change in that. We know the characteristics and properties of the virus at its root. And what we don't know or don't seem to really get through our minds as a country is the difference between our behavior today and this big lag in consequences tomorrow. So as I said at the outset of this conversation, I think that we're going to see those numbers yield, the increasing numbers right now, yield really increased death rates or new death rates in November. Hard for people to understand that there's a 30-day lag between what they do today and what they might experience 30 days from now. So my advice to the president and to the task force would be to send out some clear messaging. And it would also be for them to not only embrace the mask wearing, but it would be to clarify misperceptions about the availability and time frame for vaccines. It's pretty clear that vaccines will be available, sometime second quarter next year for the masses. And I think the masses are the important target audience here. That's a separate, entirely different message, and that's on pandemic alone. If I were him, I'd also be giving a very clear message to our adversaries that now is not the time. We might be divided on how to respond to this virus because of economic differences of opinion, but we will not be divided if anyone tries anything militarily against our country or our interests abroad.
And as we continue to near what is already a very contentious election, and of course there are still so many unknowns, any concerns about domestic unrest that might come if, say, the 25th Amendment has to be invoked, meaning, of course, as you know, that the president is forced to temporarily step aside?
Yeah, I'd like to offer a few thoughts on that. We've heard some of the history, some really good history from Terry Moran and others tonight, that it's only been used 3 times, and they were all 3 times planned elective surgeries where the president knew he was going to be placed under, full sedation. That's accurate. But in this case, I'd be looking for something entirely different. I wouldn't be waiting for sedation. In this case, it's not a surgical procedure that we're anticipating. Right now, we're hearing mild symptoms, and the president's very much in control of his faculties, and that's good. And during that time frame, he should not give up authority to the vice president or anyone else. However, where we should all, the vice president and the family surrounding the president, as we all help him convalesce through this and send our prayers to him, where we should all be worried about it, or the mark that we should all be looking to, is if his condition deteriorates to the point where he needs to be placed on oxygen, or, God forbid, if he needs to be intubated. Being placed on oxygen or being intubated for a man of his age with this virus would be a very bad sign, and that's when, if I were on his staff still, I'd be advising him to sign that letter and giving Mike Pence the temporary authority to act as president. And I'll just kind of amplify that. We have no reason to believe the president's in a really bad place right now. He seems to have been hospitalized because he's the president of the United States, has access to these facilities and to the best care in the world, as he should. But if he were a regular citizen, not the president, not with so many responsibilities that we all count on him to execute, the mortality, the hospitalization mortality rate for people in his age bracket is alarmingly high. Now, he was hospitalized, but not for the same conditions. But once somebody's hospitalized because their condition warrants it and not their position, the mortality rate is almost 40% in 3 or 4 of the states that I looked up today. That's a really bad statistic. And so that kind of outcome for people between 70 and 79 is bad. It goes up significantly, almost 80% mortality once you get into your 80s. So, the president's right in the middle of that age demographic. And I think the vice president should probably be tapped on the shoulder if and when the president has to be placed on oxygen. We hope that never happens.
And lastly, just big picture, you've been tracking the virus and the national containment efforts overall. As you know, cases continue to rise. Just how concerned are you about the winter?
Well, I'm very concerned. Point blank, I think we're going to have a significant increase in the new death rate, new death and new cases. And we've read a lot about super spreader events. Well, how do we identify a super spreader? Well, you don't know how. Everyone wears a mask. You presume you might be contagious, and so you do that as a courtesy. But you also stop large events. You don't want to have large gatherings, because large gatherings increase the odds that there may be a super spreader present and increase the target audience of people that could get sick, infected from that super spreader. And so one of the key components was not to do that. And what we've done as a country, I believe, in an ill-advised way, was to send people back to all sorts of super spreader events. Every college and university and high school that's come back to school right now with large numbers is essentially a super spreader event, and it's happening on a daily basis as they reconvene together. So it looks like, as I said, the new cases for the young are going up alarmingly, and I think quite predictably in the areas surrounding high schools and colleges that have gone back to school. And it looks like those delayed lagging numbers are starting to creep into the older population set. So I look at the age demographics for new cases. I don't look at national aggregated data. And in those places where both go up at the same time, you're really, signing a recipe for increased death. And I suspect, without really wanting to alarm people, that where those conditions have grown into that red zone of 25 or more new cases a day, we really need to think about doubling down our efforts to stay away, isolate, quarantine, wear a mask, and do all the other things that we've been told throughout this pandemic. And the reason being that we could end up not only with a big death, spike in places where it's bad, but in this country, we've only seen that in regionally contained areas like New York and New Jersey and the Northeast in the beginning. What we might end up seeing in this next round is, increased sickness and death rates in many states, and some of them in rural areas that we've seeded very unfortunately successfully, as some of these universities are in places that aren't your traditional big cities. So I'm worried about the winter, and I'm worried about the holiday season, and I'm worried about our election cycle. I think calm should prevail right now. I think the president seems to be just fine, and we should behave that way, not only for our people's sake, but also for those that wish us harm overseas, to know that we're stronger as Americans together. And I'm pretty confident we'll get through it.
Tom Bossert, thank you, as always, for your insight.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.